All right. So, what is clinical? Clinical is the application of theoretical knowledge within a patient care context under the supervision and guidance of licensed nursing faculty. ICHS uses a combination of face-to-face simulation and case studies. 50% or more of clinical hours for the program must be obtained through direct patient care. There are a total of 810 clinical hours that you must complete, every single one of you, in order to be successful in the program. Students can learn simulation hours by completing assignments within the courses. And ICHS only hires BSN Masters and Doctorally Prepared Registered Nurses to conduct clinical. That way you're getting hands-on experience from somebody that has been practicing and knows what they're doing. So direct patient care clinical experiences generally involve the hospital or healthcare setting and some level of patient contact. Students will have direct contact with patients, family members, and members of the healthcare team. The purpose of the clinical practice experience is to close the theory-practice gap and help nursing students build confidence, competence, and critical thinking skills by providing opportunities to meet each course's clinical learning objectives. Pretty much what you learn in class, you're going to be able to use it with your actual hands-on skills. So what else are you going to be able to do from the clinical experience? It's going to allow you to connect the humanistic aspect of nursing, which is caring, with the practical component of nursing, your skills. It's going to also allow you to apply your acquired nursing knowledge, apply the nursing process most importantly, and demonstrate ability to perform nursing skills. Also connect nursing interventions with disease progression and client outcomes. You will also be able to build a positive bedside manner conducive to promoting dignity and healing, develop interpersonal communication with each other and with clients, observe and understand the chain of command within various healthcare settings, learn to function within an interdisciplinary team and learn how to communicate with an interdisciplinary setting, and practice in a safe space to learn and ask questions when appropriate. Now, before you get to clinicals and before you get into lab and before you start even working with patients, something that we must all know is HIPAA. Most of you already know about HIPAA, or if you don't, I mean, problematic at this time. So HIPAA, all nursing students are required to always follow Health Information and Portability Protection Act of 1996. That's HIPAA. So HIPAA protects patients' identity, identification information, and health records. Students are prohibited to leave the clinical facility with any patient-specific information, no exceptions. Students are also prohibited to exchange personal information with the facility staff, patients, and family members. Students are prohibited to take and post pictures and information of patients, family members on any device or social media. Clinical partners for ICHS. So our clinical facilities may include rehab centers, nursing home, hospitals, or home care agencies. Some clinics as well. ICHS partners with a variety of clinical facilities. The actual list is going to vary depending on which specialty you're going to be rotating throughout. We have multiple specialties. At this time, because you guys are already on BPs, you'll be able to experience every clinical experience that you haven't done from before, every specialty. That would include fundamentals of nursing, Med-Surg 1, Med-Surg 2, your OBPs, of course, and your psychiatric nursing. Based on the specialty of the facility, that's where you're going to go based on the rotation that you have to do. You have to do a certain amount of hours for each one of the cohorts or each one of the specialties, and we'll go over that. And based on that rotation, that will be the facility that you're assigned to. When scheduling clinical appointments, students can identify the facility where they will attend. Students must self-schedule a variety of settings. That would include 2 days for your psych, 2 days for your OBPs, and everything else will fall under the Med-Surg category, which would include your fundamentals, Med-Surg 1 and Med-Surg 2. Students will utilize a system called TimeTrade to schedule clinical appointments and hours. TimeTrade is also used to schedule faculty appointments, so all of you should be familiar with the system already. Students must cancel TimeTrade appointments 72 hours in advance. Failure to do so will result in a $150 fee. Cancellation with advance notice allows other students to fill those slots. So pretty much every single one of you, once your cohort is open to clinicals, you'll receive a scheduling link. Once you go in there, you can be able to schedule as many days as you require. You will receive a clinical breakdown before you get the link to schedule. So you will know exactly how many days you need to schedule for each one of the specialties. This $150 fee not only applies to you not showing up for your actual day, it also includes any overbooking that you do. So if you get your clinical breakdown and you have a total of 25 days to complete, out of those 25 days, 2 are site, 2 are OBPs, meaning 21 are going to be medical surgical specialty. That is all you're going to schedule. Do not schedule yourself with 2 additional shifts because, I may call out, something may happen. Do not schedule yourself in April, in May, and in June because you need to talk with your supervisor, with your significant other, with your family to make plans. And you want to make sure that you get some days. Any overbooking above the number that you're expected to book will result in a $150 fee. So if you have 25 days to schedule 25. Any day above 25 will result in a $150 fee and may result in you losing every single one of your days as well that you already scheduled. So if you're overbooked, all your days will be canceled. And not only would you receive $150 for the excess, you would also lose any days that you have already scheduled. So please be mindful, be respectful. Remember, this is first come, first serve, and based on availability. So you guys schedule your own clinical days at your convenience. That way you can talk to work, you can talk to your supervisor, your significant others, your family members, arrange for daycare, whatever you need to do. You have to get all of that done before you go on your schedule your days, okay? Our clinical partners, ICHS faculty and students are guests of the clinical facilities. All students and faculty are expected to respect the facility, property, and policies, communicate professionally and positively, use time productively. You're not allowed to congregate. You're supposed to park and store belongings in approved designated areas. No cell phones are allowed or utilized during your clinical rotations in any clinical area. That includes the clinical facilities, that include your labs, and that would include your residency. All students for our clinical requirements must complete their full clearance 2 weeks prior to your first day of lab or clinical, no exceptions. Meaning if you're scheduled to come on March 15th, you should have received clearance from the clinicals team since March 1st, the latest. So if by March 1st, you did not get your clearance, you will not be able to attend your March 15th date, okay? Students must use American Data Bank or Castle Branch if you're an older student for all required documents. Documents must not be sent via email with the exception of 2 documents, and I'll go over those 2 documents later on. Failure to comply with the clinical clearance will result in a delay in participating in lab or clinical practical experience activities. All students are required to submit negative COVID-19 tests within 24 hours prior to lab, clinical, and every 7 days while in Boynton Beach. Meaning, if you're supposed to arrive on the 15th, your COVID test for the very first day cannot be greater than 24 hours, meaning 3/14 is the only other acceptable date. So 3/14 or 3/15 must be the date on your COVID test, okay? Now, you only require a test every 7 days after that. So your first day is the 15th, you did your test on the 14th, you're able to come on the 15th, you met that parameter. Now, when is your next COVID test done? 7 days after that. So not until the 21st, you would not need to do a second COVID test, and then it's going to repeat every 7 days. Now, if you go and you leave back to your state, because you were only in Florida for 2 weeks, when you come back, that test again has to be within 24 hours. So every time you travel, anytime you come back to Florida, okay, you must provide that COVID test 24 hours and not 7 days, okay? Email all results for your test to Ms. Donna Varela at ICHS.edu. Students are responsible for ensuring that all submitted requirements have been approved in the American Data Bank website and through the School of Nursing. So not only are you going to make sure that your American Data Bank is all clear and you have green X's all around, right? You're also going to be expected to receive an email from the clinical team. That email can come clearing you from either Ms. Donna Varela myself, or Dr. Babette Palmer. Fielder students, again, may still be using Castle Branch. If that's the case, still the same exact thing applies. Now, all students are expected to complete the following, and this is everything that you will need to receive clinical clearance. A background check with an annual oath and waiver, a drug screen. You must maintain practical liability insurance. Okay, now for practical liability insurance, it must be specific to student practice. Okay, so if your question is, I'm an LVN, an LPN, I already own a liability policy. Is that going to be valid? The answer is no, it will not. It needs to be student specific. I'm a chiropractor. I've been practicing for 25 years and I have liability policy. Would that suffice? No, it will not. You need one student specific policy for all clinical rotations, including your lab. Now, we don't mandate that you choose NSO. We recommend NSO because it's the most affordable pricing, which is $35 per year. And it covers you in all 50 states. Now, when you're choosing your NSO policy, it doesn't matter when you go to NSO. As long as you're using NSO, the address that you enter, the state that you enter, does not matter because it covers you in all 50 states. So if you live in California, you can choose California. If you live in New Jersey, you would choose New Jersey. And the system will make you choose your state based on the address that you're entering in the system. It will cover you in all 50 states. That is only for NSO. That's a vendor. If you decide to go with a different vendor, aside from NSO, then you must choose a policy that covers you while you're on clinical rotations in Florida. Okay? What else will you need? You're going to need a CPR card. BLS is the basic one that we require. So you have an advanced certification. That's good as well. It suffices. It covers you because it's advanced. So it covers everything that the basic life support one does. It must be from the American Heart Association. I'm an LVN. I've been practicing for 25 years and I have a different one. We don't care. If it's not American Heart Association, it's not valid. So please don't submit anything aside from American Heart Association. So if you have another one that is the current one outside from American Heart Association, then yes, you must complete another certification and you must pay for a separate card and it must be from the American Heart Association. Don't care how fancy yours is, don't care how many years you've been using it. If it's not from the American Heart Association, it would not be accepted. No exceptions. You must also maintain personal health insurance. And this has to be submitted annually. Now, remember those exceptions that I said that are not going to be under your American Data Bank those are the only ones that are going to be submitted via email. That's going to be sent to Ms. Donna Varela, and that's going to be your proof of health insurance as well as your NSO liability policy. Those are the only two things you're going to send through email, and it's going to go directly to Ms. Donna Varela. Please don't send it to me. Please don't send it to Dr. Palmer. Please don't send it to your instructors. Only to be sent to Ms. Donna Varela, nobody else. Everything else will be housed under your American Data Bank Complio system. You must also complete a physical mental health assessment. It's physical-mental, meaning it's a comprehensive health assessment. You don't need to do a physical and a mental. It's just one comprehensive assessment that covers both. Okay? You must also provide your immunization or titers. That's going to be for your MMR. It's going to be it's going to include influenza. It's going to include COVID. It's going to include your hepatitis. All of that is listed for you under your Complio American Data Bank system. Vaccinations that are going to include, it's going to be the COVID-19 vaccine. At this time, we only require the first 2 doses of vaccination, or you have Johnson & Johnson, just a 1 dose. Again, this is not a requirement from ICHS. This is a requirement from all of our clinical sites, and every single one of our sites mandates the vaccination, at least the first 2 levels. Other sites would also ask for the booster, but we do have places place you in if you only have your first 2 doses. So that's totally fine. But if you're thinking, I have an exemption, religious, health, or otherwise, you will not be able to attend clinical rotations. There will be no exemptions accepted at all. This is not our policy. This is not something ICHS is mandating. It's every single one of our clinical affiliates. And that's what I said earlier. We are guests in this facility, meaning we must abide by all the rules and regulations. We don't make the rules. Please don't get upset at us. If you have a religious exemption or you have a health exemption, there is nothing ICHS can do about this at this time. We don't have any facilities that are willing to accept non-vaccinating students, period. Okay? You must also submit an annual negative TB test, or if you have an X-ray, that's valid for 2 years. The flu shot during season, so season is about to end, so some of you may be able to get away with that. And again, as I said earlier, we are guests to this facility, and individual agencies can change the requirements at any time without any notice. So you may go and schedule yourself for 15 days at one facility. On day 11th, there was a change. You now need to comply with that facility, and you need to fall in compliance with whatever the new requirement is. If that's a booster for COVID, if that is a hepatitis B vaccination that another facility accepted an exemption and this one is unwilling to accept, whichever requirement, it may change at any time and it's out of our control. Okay? So these are not the only requirements. These are the requirements at this time that you must comply with. This can change at any given time without any prior notice, and it's not something the school can control. Now, consent is required for participation in clinical rotation. Good news. The next 3 consents that I'm going to mention, you have already signed and you have already agreed upon since enrollment. So this is just for your information. This is going to include American Data Bank. This is going to include ICHS to pretty much allow us to share with those facilities any information they require about you. This can be your health records. This can be your background check. This can be your drug screening. Any of that at any time will be shared with any of these facilities that are requiring this specific items, and we will have to comply with them and provide it to them. No exceptions. So if there's something specific that you don't want to be shared, you need to be upfront about it right now. And if it's any of these requirements, unfortunately, you will not qualify to attend any clinical rotation whatsoever. Again, disclosure and authorizations form. All of these forms for consumer reporting as well, as we must abide with our accreditation and everything else. You've already signed all of this upon enrollment. This is just for your information. Now, clinical and lab requirements. All students must self-schedule for lab, clinical, and time tree. Link will be sent eventually. It's not available yet. Please don't email me asking for the link. That will be posted in your course, and you will receive an email prior to that link with your clinical breakdown and your clinical clearance. All students must schedule their appointments to ensure travel dates and times do not conflict with lab, clinical dates, and times. All students are expected to complete their full clinical day, 12 hours or 8 hours, depending on what rotation you're in. And all students must complete 2 lab days for each course prior to their clinical days. Now, this second bullet point right here, extremely important. Whenever you are scheduling your travel dates, your plane tickets, your Airbnbs, your hotels, please, please, please make sure that any of the travel dates, any of your checkout times or check-in times do not conflict with any of your actual appointments. Meaning, if you're in clinicals, your flight departs at 5 p.m. and you're going to ask your professor to leave at 1:30 p.m. because you need to travel 2 hours to the airport, be there 2 hours in advance, and you're asking to leave earlier before the end of the day, by all means, you're an adult, you're free to go. Nobody's going to hold you back. But now you would lose all credit for your entire day. you will receive 0 hours for the entire day. No exceptions. If you left 30 minutes before, you will receive 0 hours for the entire day. Lab days are 8 hours, clinical days are 12 hours. But I have good news for you. You're going to be only 8 hours on the unit. So on site at the actual clinical facility, you're only going to be there for 8 hours. And then you're going to receive an additional 4 hours of credit based on the assignments and documentation that you're going to submit before the end of the day. All assignments must be submitted to the clinical instructor at 11:59 p.m. Eastern time of that exact same day. So if I'm in clinical rotation today's 3:15. I went to the shift in the morning shift, which was 7 a.m. to 3 p.m. I got discharged home at 3 p.m. At 3 p.m. I went home and my instructor gave me an assignment. I must complete that assignment and turn it in today, 3:15, before 11:59 p.m. Do not wait until the last minute. Why? Your computer crashes, your battery is lost, there's a power surge, you lose connection, whatever it may be, and you don't turn in that assignment before 11:59 p.m., you will lose the entire day as well. Not only the 4 hours for that assignment, but the 8 hours that you worked on that unit. It's all now gone. So please don't send it in last minute. Do not wait until midnight to send the assignment. If it comes in at 12, you lost your day. It comes in at 12:01, you lost your day. There will be no excuses of, I don't know why I clicked send at 11:59, but your professor didn't get it until 12 o'clock because there was a server delay. Not a problem. You will receive 0 credits for that entire day. So please do not procrastinate. Do not wait until the last minute or you will suffer the consequences. Now, all students are also expected to complete a total of 810 hours, as we already discussed. Students can be credited up to half of their clinical hours in simulation. That does not mean that you receive half automatically. Now, this is the exact breakdown that applies to you and your cohort. So for fundamentals, every single one of you, except for those of you that tested out of fundamentals and didn't take the class with us, will receive 60 hours and will need to complete 75 hours of direct patient care. The total for the class is 135. For MedSearch 1, there's a total of 180. 85 of those are simulation, 95 are direct patient care hours. For MedSearch 2, 180 is your total. 88 hours are simulation, 92 are direct patient care. For psychiatric and nursing, your total is 45 hours. You get 22 hours of simulation, 23 hours of direct patient care. For your OBP, it's a class that you're in, your total is 90 hours. You will receive 43 hours of simulation and 47 hours of direct patient care. And for your nursing capstone, your next semester, the total is 180 hours. You will receive 36 hours of simulation and you have 144 hours of direct patient care hours to complete. Regular and punctual attendance of clinical practice experiences are expected from all students. Students are expected to be present at clinical sites on time to begin the clinical day with all required supplies and equipment to stay the entire day. On time means arriving 15 minutes before the official start time. So if you're scheduled for the 7 to 3 p.m. shift, you're expected to be there at 6:45 a.m. If you arrive at 6:46 p.m., you're late and you will not be allowed into the clinical day. Same thing, if you're in the PM shift and you're scheduled to be there from 3 to 11, you're expected to be at the site at 2:45. Arriving at 2:46, you're late, you're not going into the day, you now lost that day. Student must stay the entire day to earn clinical credit, as we already discussed. Student arriving late will not be allowed to participate in the clinical day. Again, the 15-minute mark, 6:45, 2:45, like we discussed. Students are expected to notify appropriate personnel of emergencies or illnesses that would prevent clinical attendance at least 1 hour in advance. So this is only for emergencies and illnesses. That's the only time that $150 fee would not apply to you. Things happen. You're on your way to clinical, you suffer a car accident, you're going to be late, you're not going to be allowed in, so you now lost the day. You're going to message your instructor or the appropriate personnel based on the instructions that you receive prior to that clinical day. All of you will receive very clear directions 24 hours in advance for every single one of your clinical days. So that would include who to contact in case of an emergency or any other reason, okay? If students are late by 1 minute, they're expected to make up their date on-site clinical day at the school nursing's availability. What does that mean? You're going to see that it's very difficult to schedule your appointments in the time that you want. So some of you may need to get 2 weeks in April, 2 weeks in May, 2 weeks in June to kind of break out the amount of days you're going to need because you won't be able to find it. Now, you schedule yourself for those 10 days that you're going to be here in Florida. You missed 1 day. You may need to come back to Florida just to complete that 1 day. You're going to be pretty much at the mercy of the school of nursing and whatever is available. So you're going to have to literally pray to see if there's a call out or a cancellation anywhere else that will be able to fit you. If not, you're going to have to go back to Time Trade and schedule yourself again, and that may not be available for 2, 3, 4 weeks from that date. So it's a problem. So please, 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 please ensure that you're not missing any of your clinical days. We understand emergencies happen, and those things are all of our control. But do not be the person that decided to leave their house right 15 minutes before and arrive late by 1 or 2 minutes, because you will lose your day. And that's a very sad day, and it's very frustrating. All right? There will be no crying, there will be no begging. You simply just will not be allowed it. End of the day. Doesn't matter who you call. You can call the President of the United States of America. You will not be allowed to go into that clinical facility if you're late, okay? Again, you're responsible for canceling your shifts, and of course, $150 will be the fee as we already discussed. Now, clinical and lab expectations. All students are expected to purchase basic supplies, tools and equipment, and learning materials for clinical practice experience. These items are required for each orientation lab and on-site clinical practice experiences. First, your ICHS nursing uniform. It's a white monogram scrub top, khaki scrub pants, white nursing shoes or sneakers, white undershirt if needed, a white lab coat, or white nursing jacket if appropriate. You must also have a copy of your college issue photo ID. And before you ask, you would not receive your college issue photo ID until your very first day on campus. So when you come for your first 2 lab days rotation, at that time, on your very first day, you will receive your college issued ID. It will not be mailed to you. You cannot request it at this time. There's nothing you need to do at this time to ensure that you receive a college issue ID. You've already completed everything that you were required upon enrollment, which was your notarized ID form that all of you already completed and already submitted, and that will be used to create your school issued ID. You would also need your state issue ID. So not only will you require the school ID, also your state ID. If you miss one or the other, you may not be able to go into the clinical site. Okay? You will also be required to have a stethoscope, a pen light, and nursing scissors. In addition to the above supplies, students will also need a wristwatch. It has to be non-cloth with a second hand, a notebook or loose leaf paper and a binder for taking notes, a nursing drug book of choice, and I recommend you talk to your pharmacology professor for the most updated drug book possible. There's really no preference. It's entirely up to you, as long as it's a newer version where you will have adequate, correct, up-to-date information. Laptop computers are not to be brought to the clinical settings, but they will definitely be used in post-conference. What is post-conference for those of you who have never attended any clinical day? You have a pre-conference at the beginning of your clinical day where you will discuss the expectations for the day, discuss placement, and your schedule for the day. You go through your regular clinical day, and then before you discharge home, you're going to have a post-conference with your instructor to discuss everything that happened during the day, discuss assignments, and everything else. At that time, you will need your laptop. So you must have your laptop with you at all times. You are not to bring it into the facility, so please plan to leave this in your car. You may ask, I don't have a car. I plan on Ubering. I plan on sharing a ride with somebody. I plan on being dropped off. You got a few things to think about. The school would not be responsible for any lost or stolen items, and you would not be allowed to bring any of your personal items, except for the ones that we just discussed, into the facility. So plan accordingly, plan in advance. Okay? I suggest you speak amongst each other, and if you would all receive the email 24 hours in advance. You can talk to your peers and see who will be driving, who will not. That way you can all place your personal belongings in each other's cars or something in that regard. It's just an option. You don't have to do that. It's entirely up to you. Professional appearance, your general appearance. All students must present a clean, neat, and odor-free appearance. Students must maintain good personal hygiene. Examples, clean nails, launder uniforms, and no body odor. Some of you may be this kind of ridiculous, but kind of a lot of issues. So you don't want to be in this position, okay? The use of perfumes, colognes, and aftershaves of any body sprays is strictly prohibited. The only thing you're allowed to use is deodorant. That's it. Body tattoos must always be covered. If you have any face tattoos or any tattoos in your hands, fingers, or anything like that that you can't cover up with clothing, your only option at this point is makeup. And going to the next topic, you'll see how that's problematic. So males must have trimmed facial hair, mustaches, sideburns, and beards. Body piercing, only one small earring is permitted per earlobe. No hoops or dangling earrings, nothing greater than 1 inch in diameter or length. Meaning, no nose piercing, no lip piercings, no tongue piercings, not on top of my ear piercings, none of that. One single piercing per earlobe, and that's it. No other body piercing should be visible whatsoever. Jewelry on hands and wrists is not permissible with the exception of wedding bands and wristwatches as long as they're non-cloth bands. No other jewelry is permitted unless for religious or cultural reasons. If this applies to you, just like this will be part of your clinical clearance. So don't expect to just show up and claim a religious or a cultural exemption. That's not going to work out. So when you're getting your clinical clearance, you must submit any exemptions that apply to you, cultural or religiously, or health exemptions. You're going to submit that to the dean of the school in order to receive clearance. You must take with you that clearance to your clinical date. So if you show up to any clinical site and you're wearing things that you have not received clearance to wear, you would not be allowed to go in. Please don't try to bully your instructors and claim discrimination. You have had sufficient time to submit for an exemption and receive approval for that exemption. Asking for exemption at the time of clinical is too late, and at that time you would not be allowed into the clinical setting. No exceptions, okay? Nails must be short, not exceeding 1/8 inch past the fingertips, well-groomed and clean. They must be clear, unchipped nail polish. It's the only nail polish that is allowed. Clear, unchipped nail polish. No artificial nails will be allowed. So if you have anything like that, make sure you remove any and all before your first day of clinical rotation. No exceptions, ladies and gentlemen.
Mr. Rosales, 1 minute, please.
Yes, ma'am.
Students, good morning. Good afternoon, rather. This is Dr. Palmer. I'm the Associate Dean of the ASN program. While Mr. Rosales is presenting, as per my text, my message, please hold all your questions until the end, because the presentation he's making, you need to be aware of this, because you're going to be the same ones that are going to say that you didn't hear what he is saying. Therefore, please, I do not want to see any more questions in the chat box. I need you to be paying full attention to the presentation that is being made. Once Mr. Rosales is through with his presentation, then we will take the questions. I think that's reasonable. All right. Thank you, Mr. Rosales.
Thank you, Dr. Palmer. All right, so keep in mind, hair must be clean, well-groomed, worn off the collar. away from face and well secured. No bandanas, cloth headbands, scarves, or bows are permitted. Headwear worn for religious or cultural purposes is acceptable. Again, just like we discussed, same thing about jewelry with prior approval. That's it. So again, please don't try to ask for exemptions once you show up at the clinical facility. You will not be allowed in. You must have that exemption approved within those 2 weeks, just like for any other item within your clinical clearance. So if an exemption applies to you, you must include that in your checkoff for your clinical clearance. Makeup must be light, natural, and conservative. Artificial eyelashes are not permitted. So this is the conflicting issue that you're going to have if you have any hands or face tattoos. If you have hand tattoos, you're going to be constantly washing your hands. So any makeup that you wear to cover those tattoos is going to go away. If you have them in your face or your neck, makeup must be light and natural. So make sure you plan accordingly, okay? Uniform must be appropriately fitted, conservative, and not revealing, meaning not too tight and not too loose. So we don't want it extremely tight where we can see your personal business. We don't want it loose where your uniform is falling off and it looks too baggy and inappropriate, okay? Also, as part of all of this, that uniform must be neat. Please don't show up with the uniform. It looks like you just pull it out of your laundromat and it looks like an old rag. Make sure that your presentation is neat. You're representing not only yourselves as a professional, you're representing the profession of nursing, which you want to be a part of, and you're representing the school as well. So at any time that you wear ICHS uniform, you're representing the school, the profession, and yourselves and your professionalism, okay? Now, going to the uniform. Only approved nursing attire will be worn during clinical lab simulation and all ICHS-related activities. White scrubs with embroidered school logo, loose fitting for the tops, khaki scrub pants that are loose fitting with an open foot, white socks, white nursing shoes or sneakers, leather or vinyl, without any colorful designs, and no cloth footwear is allowed. Remember, we're going to be working with patients, bodily fluids, chemical substances, so no cloth bands for your wristwatches, no cloth materials for your sneakers or shoes. A white undershirt without any graphics is allowed, as well as a white lab coat or white nursing scrub jacket, okay? Now, for uniform orders, there's where you're gonna order all of your uniforms from. Uniform Advantage, that's the vendor that we use. You can go to the website. You may have a hard time locating the logo for the website. If you decide to go through the website, you want to order it through the website, you can go ahead and email Ms. Donna Varela and request the logo file. So you can send that to whichever company, aside from Uniform Advantage, that you may have chosen. We also have a specific form for Uniform Advantage, which makes everything extremely simple. You fill up that form, you submit it to them. That includes your logo, your embroidery, and everything. You may not want to use Uniform Advantage and use another vendor. That's your choice, as long as it respects the guidelines and falls within the guidelines and all the parameters that a uniform for our school must have, just as we discussed earlier, okay? Now, for clinical and lab preparation, there's going to be your little cheat sheet. Print this, have this nearby. This is everything that you must have before you go and you start scheduling your days. So preparation includes completing your clinical clearance requirements. That includes any exemption that you may want to submit for it. You must complete your skill videos. You must satisfactorily complete your required lab days. You must purchase any necessary equipment, such as scissors, stethoscope, pen light, pen, etc., etc. You must be wearing your assigned uniform. Failure to meet any of these requirements will indicate unpreparedness for clinical practice. Students will not be allowed to participate in lab or clinical activities. There's no makeup work. And just like we discussed before, you are expected to reschedule yourself at the availability of the School of Nursing. So if you booked yourself, you didn't show up with the appropriate uniform, the appropriate equipment, and you're sent home for the day, you now lost that day. And again, like I said, if we have the availability, good for you. If we don't, You may need to wait 2, 3, 4, 5, 6 weeks at a time and have to reschedule yourself to come back to Florida for just that one missed day. So please ensure you're following directions and you're following all instructions given to you. Again, remember, complete and submit all your American Data Bank documents timely and successfully. We discussed 2 weeks prior to your very first rotation. Ensure you have all the supplies required and needed for your lab and clinical days. Ensure you have a COVID test done at least 24 hours prior to your lab and clinical days. And as we already stated, all results must be emailed to Ms. Donna Varela. You must book flights to accommodate lab and clinical hours completion. That's what we're discussing. Please ensure that your travel time does not conflict with any of your scheduled days. And please always maintain a positive approach, mindset towards the clinical experience. Seems like it's question time, but not yet. We got one more presentation to cover. So this presentation now is Typhon. All of you should be familiar already with Typhon. Most of you have been working with Typhon for a couple of semesters now. Those of you who don't, here's more information for you so you can get all this good information that you're required to know in order to be successful in all of your courses. So what is Typhon? Typhon is simply one of the digital platforms used by International College of Health Sciences to track and manage all clinical information regarding both your simulation hours and your direct patient care hours. What is important to know about Typhon? There's two main things that you have to know about Typhon. Case logs is one of them, time logs is the other. Those are, you say Typhon, those are the first two things that should come to your mind. And honestly, the only two things that you should be worried about when it comes to your Typhon profile. Now, in the case of case logs, a case log is required for each individual assignment completed in your course, for each Shadow Health assignment, for each HESI case study, and for each patient review. If it's not a Shadow Health assignment, if it's not a HESI case study, and if it's not a patient review, please don't ask if you need to document it in the case log. The answer is no. These are the only 3 items that you must complete a case log for, okay? That's it, exclusively. Those 3 items are the only ones that require a case log. And you must do 1 per each assignment. So if you have 5 Shadow Health assignments, you must have 5 case log entries, all right? For time logs, and opposite to case logs, time logs, only 1 is required for your entire course. So for this particular class, you may have, don't quote me on this is not the exact amount, but you may have 5 Shadow Health, 3 HESI case studies, and 2 patient reviews. That's a total of 10 assignments. That's a total of 10 case logs that you must submit. All those 10 case logs are going to be equivalent to a total amount of hours, which is the description that we said from the beginning, which is your 43 hours or change, whatever the number was that I gave you initially. And you're going to submit that 1 time log at the end of your course, at the end of week 14, and we're going to cover that in a minute, for the total amount of hours. So for fundamentals, you submit 1 time log of 60 hours. For MedSearch 1, you submit 1 time log of 84 hours, so on and so forth. Okay? Only 1 time log. So you may have 10 case logs, but only 1 time log. That never changes. 1 time log for the entire amount of hours that you would receive for those simulation credit for that particular course. Okay? So how do you access your Typhon account? So I provided the direct link for Typhon right over here. You can go directly to the Typhon link, or what I suggest is you go through your Canvas access, because it will take you to the right place immediately. You don't make the mistake of going into a different portal or an incorrect portal as you may encounter with the direct link. So how do you access it? When you go to your Canvas, and under any one of your courses, you're going to have what is labeled as Student Support Services. Under the Student Support Services tab, there's going to be one in specific to Typhon. Once you click on that, it's going to take you directly to the Typhon portal. Now, all Typhon credentials are created and sent in your very first week of class for your very first class with ICHS. So all of you should already have your Typhon credentials. If you don't, by any reason, then please email support@icchs.edu and they'll be able to get your credentials. Now, when you log in, this one up here to the left will be the very first screen that you see the moment that you click through your Canvas access. You click on that Typhon login. This is the very first screen that you're going to be seeing, the one on my left. Now, it says graduate studies or undergraduate studies. Every single one of you will choose the undergraduate study category. Once you click on that, this is the next screen that you will see. The account number, it's always going to be 8303 for every single one of you. That is the school's account number, that you are a student under the school. Therefore, that 8303 is the account number for every single one of you. Okay? No exceptions. Once you enter your user login and your password, you hit login, and this is the screen that you will be seeing. This is how this looks for every single one of you, with the exception of your name in the upper right corner right here. Instead of saying sample student, it's going to have your name. Now, as I said, what do you need to look at in here? Your case logs and your time logs. When it comes to what you should be working on and paying attention to and focusing on, for number one, it's going to be add new case logs and view and edit your case logs. That's it. And number three, the very first one, which is my time logs. You can play with graphs, you can play with reports, procedures, skills. That's what every other category is for. So you can run reports and you can see what you completed, or you want the information of the skills that you've already done. That's what everything else is for. Honestly, the only thing that you have to worry about is 1 and 2 under the one category, and then number 1 under the third category. Now, the first thing we're going to do is add a new case log, right? I'm not going to explain or show you what this view looks like because it's pretty similar to what the first one is. And it's just literally for you to keep track of all your case logs that you already submitted. And if you need to go back and update anything because your instructor sent it back because it was missing information, that's how you'll be able to access it. So we're not going to cover that one. So we're going to cover how to add a new case log, and then we're going to cover how to add a new time log. So I'm not going to come back to the screens, but this will be the main screen that you come back to. So once you click on add new case log, this would you be prompted to see. This is the very first screen that you'll be seeing. So date of encounter, you're going to go ahead, you're going to choose your date for the specific assignment that you submitted. So for example, this is, I believe, week 4 already of your course. So in week 4, you may have 2 assignments that are due. This week, I have an assignment all due before midnight of Saturday night, right? So I want to complete one on Tuesday. I want to complete one on Friday because those are the times that I have available this week. Either work, whatever, that's the time that I'm deciding that I'm going to do those. So I completed one on Tuesday. I went on that same Tuesday. I went and I added Tuesday's date, and I added that specific case log for my Tuesday assignment. Then for the one that I'm doing on Friday, I'm going to go ahead once I complete it and enter the date of Friday and enter my case log information. Your case log date must match the exact same date that you submitted that assignment through your Canvas access. It can be Shadow Health, it can be HESI, whichever the platform is, that submission date on that assignment you completed must be the exact same one reflected in your case log, okay? Now, once you actually add that case log and you enter all that data for the date, you chose your date, you hit save data, this is what's going to prompt you next. Before you get to the screen, for every first new user, you're going to have to choose your preferences for the system. Whatever preference you choose is entirely up to you. You can choose the one that you're going to be using the most. You can choose the class that you're currently in right now. If you're only taking one class, it's entirely up to you. It makes no difference because you would still be able to change them around and edit them for each one. So before you see the screen, the very first time you hit add new case log, you'll be prompted to a screen where you have to choose your preferences, right? Once you've done that, this is how your case log screen looks like. In here, you're going to enter all the information, semester, course, preceptor, clinical site, all that good information that you're going to enter, that you're required to enter. patient demographic, pretty much complete everything that's in the screen. Once you've done all of that, the main focus of this case log are going to be your procedure skills, okay? Procedures-skills. This is the most important part of your case logs. This is the main reason behind your case logs, is to be able to track all of the skills that you have completed so far and to make sure that everything that you're required to complete when it comes to your skills during your class, you've met every single one of them before that class is over, right? So at the bottom of this, there's a 2-page. I couldn't fit it all into one. You're gonna have some more social problems, and this is where you're gonna free type all of your clinical note information, okay? Now, I made this screen specific just for the skills. Once you click on any of the categories, all of the skills are gonna drop, right? So as you can see, there's a general category. I'll click on that, and these are all the skills under the general category. You will choose whatever skills you did for that day, right? Based on the assignment that you're doing. So if you're doing one for alcoholism, make sure that any skills that you do is in regards to alcoholism. If you're doing one about Alzheimer's, infection control, whatever it may be, the skills must follow the exact same assignment that you're doing. So if it's about Alzheimer's, any skills that you choose must be related to Alzheimer's, and so on and so forth, okay? That will be reviewed by your instructor and approved or not approved based on whatever it is that you submitted. So please, please, please pay close attention to that section of your case log. Now, that's it for your case logs. When you complete all of that, you're gonna save it, you're gonna label it to make sure that you're labeling it with the specific assignment. So whatever the name of the assignment, you're gonna label that case log as well with that assignment, and then you're done with your case log. Now, we're gonna move into the time logs. Time logs, as I said, only one time log is required for your simulation hours for your course. So you're gonna enter just one at the end of the semester for the total amount of hours if you were successful in the class or not. Just pass or fail. There's no makeup assignment. There's no in between. There's no percentages. It's an all or nothing. So either you pass the entire course successfully or you fail the course. So if you fail the course, please don't bother submitting hours as they're not going to be approved. If you did successfully pass the course, you're going to submit your hours here and your instructor will approve it. Now, the screen right here on my upper left corner is what you will see once you log in. If you have any time logs in the past, this is where your entire record will be in, okay? This is where your record keeping for all your times that you've completed so far will be in. Now, this should look very different to probably what most of your profile looks right now. So I am right now a student in MedSearch 1, meaning I've only done my first semester, which was Fundamentals of Pharmacology. Pharmacology does not have a clinical portion, therefore I did not submit any hours for pharmacology. I did complete my fundamentals class. For fundamentals, I completed. I know I'm only going to get awarded a total of 60 hours for simulation. So I have that already in my record, right? And I have my 60 hours that were approved by my prior instructor. Some of you may say, I don't have that. Mine doesn't say 60. I have 1.5, 3, 0.6, 6.8. It's all over the place. Don't do anything at this time. There's nothing that you need to do for any prior entries. Once you come into clinical rotations, you'll be meeting with me one-on-one and we'll be updating your record. So you don't have to do anything at this time. Please don't email me asking that you need to delete it, that you need to add, that your hours don't make any sense. There's nothing that you need to do. If it says 150, leave it at 150. If it says 0.3, you leave it at 0.3, okay? Everyone receive very erroneous information or misleading information about the ways to document in Typhon in the past. Therefore, anything that happened in the past, you don't need to update it, edit it, or do anything. You'll receive clear instructions once you meet with me one-on-one, and we'll go over anything and everything specific to your record. So, in my case, again, I'm a MedSearch 1 student. The only record that I have is my fundamentals for nursing, my 60 hours of simulation, as I have not done any direct patient care hours, as my cohort did not get a chance to schedule any clinicals while I was in my first semester. I'm now in my second semester. I'm hopeful they'll be able to do my direct patient care hours, but that's not a guarantee yet either. So what I do now, I'm going to go ahead and I'm going to add a new time log. So up here on top of my log, on the upper left corner of my record, it says add a daily time log. I'm going to click on that, and this is the other screen that is going to populate after I click on it. There's 4 fields I need to enter all that data. So the date of the time log. Now, the date of the time log for your simulation hours, it's going to vary per each one of your courses. For me, I need it at the end of week 14. Your instructor may have other plans, so you can ask your instructor if it's not posted in your syllabus. The deadline for your time log is at the end of week 14 of the semester, okay? If it's not stated in your syllabus, that's when the due date is. So if you finished it in Wednesday of week 14, your date will be that Wednesday. If you finished it on Thursday, your date will be that Thursday, and so on and so forth prior to the last day of that week 14. So the day may vary amongst all of you as long as it's within that last week 14 of your cohort. That's the day that's going to be in. It's going to vary depending on what you have completed or have not completed up until that time. Now, you selected your daytime, you selected your course, your clinical site. It's always, always, always going to be virtual simulation. Always. There's no other choice that you need to make. The only choice that you're making when submitting your time log for your simulation hours is virtual simulation on the clinical site. Your preceptor is going to be your instructor, your professor. Now, once I enter that data and hit save, this is what's going to prompt. So again, I was a Message 1 student, as I told you. So I chose my Message 1 class, right? My clinical site, as I said, for all virtual hours, it's virtual simulation. My preceptor, I left it as simulation. I don't want to use any instructor, but your preceptor will be your instructor. Now, I have to now complete down here at the bottom the breakdown of my hours. If I'm just submitting right now for Message 1, I'm going to be submitting a total of 85 hours, right? So I'm going to put it for the total shift time under hours, 85 hours. And then under simulation, I'm going to put again 85 hours. The total amount of hours, it's your total for the entire course. Your simulation is you defining that this particular hours are exclusively all from simulations. So 85 under total shift time, 85 under simulation. Under notes, you're going to include that this is a total of all the assignments for your HESI case studies, your shadow health assignments, and your patient reviews. Now, there's 2 types of time logs that you're going to do, okay? Case logs are the same. They're due with the assignment that you're doing, so you don't have to worry about that. The case logs are the same all around, both for your theoretical part, your lab classes, your clinical classes. Case logs are the same all around. Now, for time logs, though, for your didactic classes, for your theoretical part, you only need to do, like we just discussed, 1 time log for the total amount of hours. And that's, as I explained, this is how it looks. 85 hours total shift time, 85 under simulation, and that's a total of my shadow health, case studies, and patient reviews. That's how a simulation time log will look like, and I only have to do 1 per semester. That's it. Now, for my direct patient care time logs, I have to enter 1 for every clinical day. Now, 1 in total, 1 for every clinical day. So you have 7 days scheduled for this week. I have to have this week 7 time logs. How does that look? As we discussed in the previous presentation. Again, the course, the clinical site, and the preceptor, that's all going to vary depending on what site you're in, what rotation you're in, and who your preceptor is for the day. That varies. That's something that's going to change for every one of your submissions. What never changes, though, is the breakdown of the hours. So your total shift time is a total of 12 hours, as we discussed. In your clinical site total, you were present at the clinical site for only 8 hours, and you received 4 more hours for documentation. So what's the breakdown? 8 hours on site, 8 hours for documentation, 12 hours total. That's how all your direct patient care time logs should look like. No exceptions. There's no 8, there's no 10, there's not 11, there's no 7, nothing but 12. Remember, it's all or nothing. You either get credit for all the hours or you get 0 hours and you don't have to submit a time log. Now, important reminders. All case logs must be approved by your course instructor. Whoever your preceptor is that you assign, that is the only person that can approve that. So if it's not approved, that is the person you're emailing to ask why your case log has not been approved. Okay? The exact same thing applies to time log. Whoever the person is that you chose as a preceptor, that is the person responsible for approving your case log and your time log. So if you chose Professor Diaz as your preceptor, please don't email Professor Brett, don't email Dr. Palmer, don't email myself to ask why that time log has not been approved. Okay, we will not be able to give you an answer. The only answer that we'll be able to give you is by reaching out to Professor Diaz and asking her. That's your job to do. You don't need a messenger, you don't need an assistant. So please, if there's an issue with any of your time logs or case logs, whoever the person you chose as the preceptor, that's the person you're going to be addressing your questions to. Case logs are due simultaneously with your class assignments as indicated by the course syllabus. Again, like we discussed already, you have 2 assignments due that week. You have 2 case logs due that week. Okay? Time logs for simulation hours are due at the end of week 14 or as indicated by your course instructor. Again, like I stated before, you do 1 single time log for your simulation hours at the end of week 14 or whenever your instructors have decided that this will take place. If they decided it's at the end of week 13, then it's at the end of week 13. It's entirely up to your course instructor and whatever the syllabi say for all of these courses. Case logs and time logs for direct patient care clinical days are due on the same day by 11:59 p.m. Eastern, just as we discussed before, right? Today's 3:15. I went to my clinical site day today from 7 a.m. to 3 p.m. I got discharged home. I went home. I got home at 3:15. By midnight of that day, I have to do now 3 things I have to do. One is going to be my care plan, which is my assignment that I have to email my instructor. The second one is going to be a case log that I have to enter for that one day. And the third one is going to be the time log for that day. Failure to do any of those 3 things will result in you receiving 0 hours for that entire day. So those 8 hours that you spend on clinical, if you don't complete your assignment for the class, your case log, and your time log, all before midnight of that exact same day, you will receive 0 hours. Now, if you require more information or you want to have more information about Typhoon, I've attached a link in here. You all have access to this presentation. You can access that link and you're going to have hours and hours and hours of video tutorials about everything that is inside of Typhoon. Again, both of these presentations have been posted in your courses. Every single one of you has access to this, and this meeting, of course, is being recorded for everyone to be able to review at any time if you have any additional questions. Please look at the information provided before you decide to send an email to anyone at all. If you send an email for information that was covered in this presentation, I and anybody else would reply back to you, pointing you to the presentation where all of this information was discussed. So please read, pay attention, and before you ask any questions, make sure you've gone through absolutely everything and every tool that you have available to you. And once you've determined that information is nowhere to be found, then at that time you should ask questions. Okay? This time, I'm going to allow your professors and Dr. Palmer to bring up anything else that they would like to discuss, anything that I may have missed or they would like me to cover, and either have any other anything else to bring up, then we'll start taking questions, so you can start raising your hands at this time. Mr. Diaz, Dr. Thread, Dr. Palmer, anything you guys want to add?
No, everything that needs to be added is covered in the presentation that you just did.
Excellent. Thank you, Dr. Palmer. All right. So with that being said, let's start taking questions. Kenisha Miller.
Hold on, Mr. Rosales. Let me just go back to these questions that were here before. So the question is, what is the time frame for clinical and lab? That was written by Ijeoma.
The time frame for clinical and labs, it's 8 hours a day for
Is
the
that
lab.
what you're at? Yeah, and 12 hours for, I think what she's asking is the time frame in which she will be able to, Miss Ijeoma, are you asking about the time frame in which you'll be able to complete your hours, or what exactly are you asking? Okay, we'll get back to her then. How many days can you schedule your time trade at a time? How long can you stay in Florida for? What is the cap on the days you can schedule to stay? You want to take that, Mr. Rosales?
Sure, Dr. Palmer, thank you. So the amount of days that you're going to be allowed to book in Florida will be the one that you received on your clinical breakdown. Once you receive that clinical breakdown email, it's going to tell you exactly how many days you need and for which specialty. If your clinical breakdown says that you're required to do 32 days of clinical, you can go ahead it's entirely up to you if you want to go ahead and book yourself for all 30 days in a row, as long as it's available. And we have the availability here at the school. It's entirely up to you. You can do every other week. How you schedule your days is entirely up to you, as long as you complete all your clinical days within the time frame of your clinical semester, and you don't overbook anything in addition to what you receive in your clinical breakdown. So if it says 25 days, you can book 25 days, and you can book all 25 days consecutively if that's your choice.
Okay. Can you use a passport ID? You can, Kayana, you can use a passport ID as your government issued ID, which is going to be presented at every clinical and lab admissions. So you can use that. If that's your government issued ID, then yes, you can. Zahara says, so no laptops in the facility, right? Not exactly making things easy, leave your 1,000. So I'm going to ask that when you guys communicate within these media, you keep it respectful. We're here to help you, and we are giving you information. So your comments, I'm going to ask that moving forward, your comments are respectful and they remain within the professional level, please. We ask that you do not take your facilities and belongings in these facilities, your belongings and your laptops, etc., in these facilities, because we do not work there. Number one, there are limited spaces within these facilities. If you lose your things, they will not be responsible, neither will we be responsible for that. You can take your laptop, but your laptop is not used until prompted by your clinical instructor, which it is sometimes used at the end of your clinical day in post-conference. So that is when you're going to now take your laptop, and that's when you're going to use your laptop. I hope that answers your question. Mr. Rosales, you can take it from there. I just wanted to go through these questions.
Thank you, Dr. Palmer. All right, so Kenisha.
Hello and good morning. I have two questions. My first question is, for those who have been granted the experiential credit hours, how is that distributed? I recall you saying like fundamentals has a certain amount of hours and so forth. So how does that work?
So the amount of hours that you receive for your experiential credit will go towards your total amount of hours that you have to complete in total. So depending on where you work at that facility, those hours were assigned based on certain specialties, and that breakdown will take care of for you. We'll let you know exactly when you receive your clinical breakdown. how many hours of each specialty you need to complete.
Thank you. And then my last question is, do we have an idea of when clinicals may start so we can start preparing?
So right now you're an OB-PEDS. At this time, only capstone cohort is in clinical rotation. Hopefully within the next month or two, we'll be able to open it to every other cohort, but that's not something that has been yet confirmed or that I can confirm for you. So at this time, I can't give you a better answer than that.
Okay, thank you so much.
No problem.
Okay,
Thank you.
Mr. Rosales, let me just chime in regarding the experiential credit. We posted an announcement on the experiential credit website. Please, I'm going to ask that every single student, if you applied for experiential credit, you need to read that post that was the information that was posted. You do not need to be emailing us about your experiential credit. We're aware. We're in the process of completing them. Once completed, then your grades will be posted. It's going to take a little bit longer than 1 or 2 weeks, sometimes maybe 3 or 4 weeks, depending on the amount we have to actually evaluate. Also, we use a rubric to guide our credited hours. So that rubric is what is used across the board for all students. All right. Just wanted to make sure you're understanding that your experiential credit, if you applied, we are in the process of doing the evaluation and communicating that.
Thank you very much, Dr. Palmer. That's appreciated. I have been also bombarded with emails. So just as Dr. Palmer stated, we're in the process of reviewing, and once a decision has been made, one way or the other, you would be advised as to what happened, what you received, or did. Thank you, Dr. Palmer again. Annette?
My question is about, good morning. My question is about those of us who tested out of fundamentals. I just want to understand clearly, because I think you said, I don't know if we're going to get credit for it or not, the 60 hours. How does that go?
So if you tested out of fundamentals, good for you. Great job. Instead of 60 hours, you're actually going to get a full 135 hours after you go through your lab rotation.
Which is already, which we will communicate to you in your break calculation, in your breakdown once we send that email to you.
Thank you.
No problem. All right, Diosolina?
Hi, good morning. I was wondering if there was a way I can schedule a Zoom meeting regarding American Data Bank, because I've been trying to email Dee Varela and also Dr. Babette regarding my American Data Bank, and I haven't gotten a straight answer, and it's been like 2 to 3 months regarding my issue, and I still have like a straight answer.
Janice?
Yes, good morning. I was wondering, are we allowed to use an electronic drug book on the floor through our phones, or does it have to be a paper drug book?
Correct. No phones or any devices will be allowed on the clinical site, so it has to be a hard copy book.
Okay, thank you.
No problem. Sylvia?
My question, sir, is regarding about the typo. Sorry to bring it back. When you say when we are going to do one-time blood, they added a new thing in our typo patient reviews, but we don't see it in the selection about patient review. Do we still have to choose HESI and then to put in the note patient review, because it doesn't give us that option. HESI case study, it does give us in typo, but it doesn't give us the option of patient review.
You mean inside your case logs?
Yes, because when we do our typo, like for example, we do our typo for SharePath, for Shadow Health, there is an icon there that we can click about Shadow Health simulations. And there is an icon also for HESI case study, but there is not an icon for patient review.
So what you're going to do is you're going to choose virtual simulation.
No, yes, we do virtual simulation, but that's what we do when we do for HESI, but then they give us a choice to pick shadow health or HESI case study. This one doesn't, okay, I got it. Virtual simulation for case, okay, thank you.
Yes, ma'am.
That's what I said. Thank you so much.
No problem, no problem. Jaswinder?
Good morning. My question is, as you mentioned, there's clinical from 7 to 3. We have to document everything before 11:59. How about if we work like a PM shift, start at 2:45? When is documentation due for that?
The exact same thing. You have, instead of 8 hours like the other students, you're going to have 1 hour to complete all of that.
No, Mr. Rosales, they're given until 7 a.m. in the morning to do so.
Oh, I'm sorry. My apologies.
Yes,
There you
because we count that hour. And if you work at 3 to 11, then you do it, that you turn it in at 7 a.m. So you get the
Oh.
exact same time that everyone else.
Thank you.
Thank you.
go. Jonah?
Yeah, Dr. Palmer called me earlier. Good morning, everyone. My question about the clinical time frame, the other lady asked it and you answered it. So I think I'm good on that. If we can know, like we're going in 2-3 months or in a month, then we can schedule ourselves in our job and know how to put in our papers to take excuse from work to go and do the clinical. So that's what I was asking about time frame.
So you definitely receive that information in advance. Hopefully as soon as possible, hopefully at the end of this semester. If not, you would receive that information in the first few weeks of the semester. So you have plenty of time to schedule out all your days.
That was my
But
question.
we'll give you
Thank
sufficient time so you can make any arrangements that you need. And you're pretty much going to have about a 3 to 5 month period to
Wow.
get everything that you need done.
Okay. My second question, can we do our clinical, like if we need 6 weeks, can we just go ahead and schedule ourselves for 6 weeks? Can we go ahead and schedule ourselves for 3 weeks? Whatever it takes for us to complete the clinical hours. Can we do that at a stretch, or do we need to divide it into 1 or 2 or 3?
Like I said it before, it's entirely up to you. You can do it in a row, you can do it separately. As long as you get all your hours completed, it's entirely up to you how you do it.
Thank you. That's my question.
No problem. Irene?
You had mentioned that some people might get away with not doing the flu shot submissions. What did you mean by that?
Meaning that the season for the flu, it's done after 3/31. So if you're on rotation from 3/31 up until October, there's no vaccinations at that time for flu. It's out of
And
season.
then, so if we don't have the submission for the paperwork, we can't do clinicals?
I'm sorry,
or-
say it one more time?
So we don't submit the paperwork that shows proof we got the flu shot by the 31st, we're not going to be able to attend clinicals, like we won't get clearance, or
No.
That's just-
That's not what I stated. So remember, the flu vaccine, it's a seasonal vaccine, okay,
Yeah.
that you must have. The flu season goes from October to March 31st. So if you start your clinical rotation after March 31st, you may not have to have a flu vaccination as long as you finish before October. So that's
okay.
what I meant by some of you may get away with not having to take the flu vaccine.
Okay. My second question is, I got an email from Complio saying that I was due for my booster, but you're saying that we're not required to have the booster. So do I follow Complio, or do I follow what I'm being told today?
So it's one and the same. Like I stated before, at this time, we're not mandating the booster. Some of our facilities are, and this may change at any minute. So if you only have 2 doses, you can go ahead, you can email Ms. Donna Varela, and she will clear your system as long as you have the first 2 doses.
All right. Thank you.
No problem. Need to?
Oh, hi. My question is that I was trying to set up a Compolio and I'm having a trouble with that. Even though when I picked up the packet, it's asking, like it's giving you some other option where I don't know what else to pick from those options. Is there a certain criteria or something that you guys can put up on an announcement that we can follow how to do that?
Yes, so all of that has already been published in all of your courses. There's one specific to Complio. I myself uploaded that into all of your courses with the actual breakdown of how you're supposed to go. Once you go on the website and you start scheduling it, there's a very, very simple to follow website that will tell you exactly what you need to do, and that is compliance. ACHS compliance, and I share that screen with you guys right now so you can all see it.
Okay, please. I really appreciate that because I've been having trouble with it.
Of course. That's what this website looks like. So when you go into your website, it literally tells you everything that you have to do, 1, 2, 3, 4, 5. And then it literally tells you down here the packages you have to choose for your fingerprints. So make sure we read. Okay, so it goes 1, 2, 3, 4, 5. Everything is in there. As you go through it, it will tell you exactly what you need to purchase, depending on your state and the length of your program. And then, in addition to all those packages that you're going to purchase, which includes if you have a professional license, you have to choose that professional license verification. In addition to that, once you finish with this first 5 steps, you have to exit that screen and come back in here. So you can order also your vax. So you can actually do it through the actual system. You don't have to come back to this website. Inside, once you've done the first 5 steps and submitted your payment, you can go to the a la carte option and then choose the vax fingerprinting option. And this for in-state and then out-of-state. If you're in Florida, you're going to choose just vax fingerprinting. If you're outside of Florida, you're going to choose out-of-state vax fingerprinting.
Thank you, Ruby. Thank you.
No problem.
Appreciate it.
No problem. Hugh?
Hi, good morning again. Quick question. You mentioned that we use Uniform Advantage and that there's a paper that we can request or like a link to just purchase through ICHS. Who do we email again for that?
Ms. Donna Varela should be able to send you that order form.
Thank you so much.
No problem. Hugh?
Thank you for your time and answering all our questions today. My question is regarding, sorry, I just blanked out. Regarding the email that everybody is going to receive for the time that needs to be that allotted to them. Is it an individual email or a mass email to every student with like the same number of hours that we needed?
It's an individual email. Each one of you will get a separate email with specific breakdowns based on your hours and your hours alone. Every single one of you may have different hours, depending on what you completed, what you've applied for, what you've been successful at, and which cohort you started or not.
Okay, thank you very much.
But yeah, each one of you will receive a separate one. Aline?
Yes, good. Well, it's afternoon where I am. Actually, I wanted to know about the experiential credit hours. Are you gonna open up application again for that? And
Not at this time.
Closed. No, okay.
Not at this time. No, that was something that we used during COVID emergency and the pandemic emergency. That's something that has now been halted at this time.
Okay.
Janice?
Thank you. You kind of breezed over the time trade piece of scheduling. You said we should be familiar because we do schedule with faculty and tutorials. However, will there be some type of tutorial offered for proper scheduling for clinicals, or is there going to be a video or a PowerPoint? Because I would imagine there's probably some nuances that are not identical to scheduling to meet with the faculty.
It's really not, but that's a good question. So pretty much this is what you're going to see. You're going to get a link You're gonna get this link, and this is what you're gonna look at. You're gonna have the
Okay.
specialties. Not all specialties are posted. This link is not fully functional yet, but you're gonna have your lab skill check off, your mental health nursing, your care woman, and then you're gonna have a med search category. Once you click on those, you're gonna hit continue for whatever the specialty is, and the system will literally tell you what's open. So anything that's blue will be open, and then it will tell you the dates that are available for those times, and anything that may be available at that time for that particular specialty that you're choosing.
And what you're showing us, are you referring to like the 13th, 2027? Is that?
Correct.
what's
So
going
this
to-
is the system. You chose a specialty, and then you can go through the months, whatever months you want to schedule that. So let's say you discussed it at work, and what you have available is going to be in
Right.
May. So you went to May, and for specialty of pediatric, OB and peds, these are the available days that we have in May. The 4th, the 11th, the 18th, the 25th, the 14th, and the 28th. You click on whichever one works for you. You're gonna need to do 2 days. So you're gonna do the 11th, and you're gonna do the 14th. You're gonna schedule those days. You choose the day, hit continue, and then it will give you all the information that you need. But at this time, the link is not available yet. So
Okay,
It's
and we
very-
will know it's available.
yes, it will be posted
How?
in your course once clinicals are open to your cohort.
All right, thank you.
No problem. Let me just, based on that question, please don't waste your time if you have friends in other cohorts that are already in clinical rotations, asking for the link so you can jump ahead and try to schedule your days. That's not gonna work for you. If you schedule outside of the cohort that you're in without proper clearance, you receive a cancellation and you receive $150 fee per day. So that can be really heavy if you go ahead and schedule yourself for 30 or 45 days. You're looking at a whole new tuition, probably a car's worth of fees. So please ensure that you're not creating additional work for any of the faculty or any of the IT team by asking your colleagues or any other student for the link. Once it's made available to you, you receive clear instructions on how to schedule and how much to schedule. Okay? Sonia?
Yes, good morning. My question is about the uniform. So are we allowed to cover our hair, for example, in the clinical sites? And then what
None of this
color
is
we
a
have to cover?
cultural or religious exemption, and if that's the case, you're gonna need to submit an exemption request to the Dean of Nursing, Dr. Palmer, for approval.
No, it's not religion purposes. It's
Then no.
like the nursing hair cover, the one that you use for the COVID patients and stuff like that.
No, ma'am.
No?
There'll be nothing worn in your head or any jewelry whatsoever. Not even bows are allowed. If you need any PPE equipment, that will be provided to you at the facility.
Okay, so we can actually request the log file to buy uniforms here in California if I need to, just to provide the school logo. Can I request that, or we have to go through the uniform website that you
No,
mentioned?
if you have another preferred vendor, as long as it follows the parameters of our uniform, you can buy it from whoever you want. And then if you need the logo, because you're gonna need that embroidered, you can ask Ms. Donna Varela, and she will send that in email to you so you can have that logo.
Okay, and my last question is about the picking up the dates for the clinical hours. So if you they're gonna give us the opportunity for us to have time to choose all those hours, so we're just gonna they're gonna open the schedule for everyone at the same time.
So the schedule is going to be open by cohort, and only the people who have received clearance will be allowed to book. So I may post it in your course, and in your class, there may be a total of 50 students, but not all 50 students will be allowed to schedule. Will have access to the link, but if they schedule any days without clearance, they will encounter a $150 per day fee in addition to all the days being canceled. So it's entirely up to you how fast you schedule. Just make sure you receive clearance first.
Okay, thank you. That's all. Thank you.
No problem. That was Sonia, right? Yeah. Mary Magdalene?
Hello, everybody. Thank you, Mr. Rosales, for answering our questions. So the question I have is about typhoon, and as what I have understood you say is that we can use the preceptor as our professors. In MedSurg 1, we used Bobby Permit as our preceptor. Has this changed now?
Correct. Like I stated, you have to choose your instructor as your preceptor for all your case logs and your time logs. Whoever your preceptor is for the day, if it's in your theoretical part, it will be your instructor. If it's in your clinical day, it will be whoever your instructor for that clinical day will be.
Thank you.
Lorna? Lorna, you muted.
Morning, sorry.
No problem.
So my question is about the American data. Which options do we have to pick on those? There's different prices.
So the options are detailed on that screen that I just shared a minute ago. That is posted in your Canvas. You're going to go and access that. Look for it in your Canvas. You're going to have to actually document the guide of what you need to choose or not in there. And then once you access that website that I just showed a minute ago, it's going to walk you step by step everything that you need to choose, because it's different for each one of you. It depends if you have a license, if you're an LVN, if you're a chiropractor, if you're neither, it would differentiate. So it's different for each of you.
Thank you, sir.
No problem. Yuselina?
I have another question. Are we going to be doing our clinicals while we're doing our online classes?
You may. At this time, that's not what's happening, but that's the way that it's supposed to be happening. But at this time, we don't have enough availability to offer you guys that option. So at this time, that does not apply to you. But yes, that's the way that it's supposed to be.
Okay, thank you.
So that was the last question. We still got some time to spare. Beautiful. Professor Diaz, Dr. Palmer, Dr. Threat, anything else?
No, if you guys are unaware where the clinical announcements, where they're stating that the list of items that you need in order to be cleared for clinical, just go into Canvas in your clinical course under announcements. You can see it, just go one by one through the announcements. This is another reiteration. If you do not have your notifications set to get your announcements from Canvas, please do that, because we're getting a lot of emails, both clinical and non-clinical, with course-related information, and the answers are all in the announcements. So please, please, please look at your announcements, because that's going to give you everything you need to know. Okay?
All right. Thank you, Dr. Palmer and Mr. Rosales. That was amazing. You provided wonderful clarity. You guys were so patient and listened, and hopefully that answered all your questions. I will repost this so you guys will be able to look at it specifically again. So it's all recorded, and we'll be able to look at it and go through it one by one and look at it again. But thank you guys for coming. We'll be mindful of your time because we know you have other meetings. So we appreciate your time today.
Thank you.
You're welcome.
Thank you very
Thank
much.
you for having us.
I have a question. I have one more last question. Sorry to interrupt. I did pose a question, and Professor Diaz answered that we do. This is in regards to the forms that we have to submit to the doctor. One is that form that is asking our capabilities, if we're able to lift. Is that the same as physical, or is that just an individual form that also the doctor has to complete?
Well, the system only provides you with one form, which is going to be your attestation. That is separate from your physical and health assessment.
And what do we physical? So the physical, Zahara.
Yes.
When you go to do your physical, the paperwork that the doctor uses in office is acceptable. So you can have him use that and do your physical and send it over to American Data Bank.
Perfect. Thank you.
You're asking, correct?
Yes, that's what I was asking. So the attestation is by itself, and then the physical is okay. Thank you so much.
You're welcome. Okay, goodbye, everyone.
Bye. Thank you, guys.
Thank you.
You're welcome.
Thank you.